Hello everyone and welcome to Divyam Clinic channel. Today we want to share the journey of a beautiful patient of ours who underwent breast reduction surgery with us. In breast reduction surgery, we reduce the excess breast tissue to make the breasts more proportionate with the body. Many women who have large breasts face breast pain, posture issues, and lack of self-confidence. With this surgery, they regain their confidence and the breasts also become proportionate to their body. This girl had heard of us through her friends, and her first consultation was an online consultation from the US. Once she was happy with all our answers, she came for an in-person consultation at Divyam Clinic. We thoroughly explained the procedure to her, and then she decided to go in for the surgery, the breast reduction surgery with us. So let's hear in her own words what she was suffering from and why she opted to go in for this surgery. So today we are going in for a breast reduction surgery.
Hello. So I have had this problem of having large breasts ever since I was a teenager, and it's been such a huge hindrance in my life because I like to be very active in sports and stuff, and it causes the sagginess, and breast causes pain while I'm doing certain activities. So I have been restrained in some ways all my life, and I have been looking forward to get breast reduction. And I was told by some of my friends to consult Dr. Anjali Saple. I have consulted her online, and I have had obviously huge pleasure of talking to her. She's been very knowledgeable, and I really do appreciate her. And I came in for in-person consultation, and she has giving detailed instructions of everything to me and my mom, who's been kind of paranoid. But I am really looking forward to how the procedure turns out, and I'm very grateful for Dr. Anjali Saple.
The first 24 hours after surgery are the most crucial because this is when the patient is recovering from not only the surgery but also the effects of anesthesia. There is some amount of post-operative pain and swelling, so the patient does have a slight discomfort, but our team manages this very well through medical treatment and also psychological and moral support. She's all set to get discharged. Let us see how she's feeling and whether she's ready to go home.
First of all, I'd like to say a huge thank you to Dr. Anjali. She has been compassionate throughout the whole procedure, and she has done a fantastic job on me. As soon as I regained my consciousness, I could feel my breast being a lot lighter, and after the pain medication, the pain has subsided, and now I feel almost ready to go home and perhaps settle in my new breast and enjoy all the activities that any normal person would do every day. I think this has been a huge help from Dr. Anjali, because like I said, large breasts have been a hindrance all my life, and I could not have found a better surgeon to operate on me or take care of me. I thank Dr. Anjali and her whole team.
We normally call the patient for a follow-up at the end of 10 days. This girl we saw at the end of 10 days. At this time, the wound starts healing well. The pain is much less. The breast is shaping up well. The patient can go back to their day-to-day activities. Of course, no strenuous activities at all. And at the end of 10 days, let's see what Janvi had to say.
Yeah, I'm like ma'am said, it's been 10 days, and I feel absolutely thrilled. I feel loads lighter, and the post-op care has been fantastic. Ma'am and her whole team, and I couldn't be happier with the results. I'm just looking forward to participating in sports and activities, playing tennis, stuff like that, and hopefully see how my breasts kind of adapt to, and I'm looking forward to all the things. Thank you so much, Dr. Anjali.
So the final step in this patient's journey of ours was at 1 month follow-up, just before she was ready to fly back to the US. The wounds had healed well. She was feeling more comfortable in her own skin. The breasts were shaping up well. Of course, the finer shape will be evident only at 3 months, but she was totally pain-free, and she was all geared up to get back to her fitness routine.
Hi, my name is Janvi, and I just had my breast reduction surgery done last month by Dr. Anjali, and I'm here to give a 1 month review of how I'm feeling. Surgery went very well, and I was quite content in the initial 3 weeks, and it's been a month. I've been resuming all my day-to-day work stuff, workouts, and everything, I feel a lot lighter. And honestly, my shoulder pain and back pain that comes with having heavy breasts is also gone. And the healing has been pretty easy. There have been no issues of sepsis or any sort of stuff. And I've always had, Dr. Anjali or her team to assist me should I have any questions, and I could not be more happier with the results. I'm honestly looking back to just being more active, which I am right now, and my breasts are recovering one day at a time. But I'm pretty content with the results right now, and I would like to thank Dr. Anjali and her team for assisting me with the surgery. And I will also say to anyone out there who is terrified or worried about having huge breasts, seek medical help. It really is a blessing in disguise. So thank you, Dr. Anjali. Thank you very much.
Thank you for being a part of our beautiful patient's journey. If you're curious to know more about breast reduction or you're facing similar issues, don't hesitate to get in touch with us at Divyam Clinic. Also, if you found this story interesting, do like it, share it with friends, and subscribe to our channel.